Hello, ladies and gentlemen. My name is Jae Kim, and I'm a PhD student in the Department of Sports Medicine at Jeonju University. Today, I will be presenting on optimizing exercise prescription in cancer through mTOR pathway understanding. This slide outlines the structure of my presentation. I will proceed in the following order. First, I will begin with the introduction. mTOR stands for mammalian target of rapamycin. It is a central regulator of cell growth, protein synthesis, and metabolism. Importantly, mTOR plays a critical role in both cancer cell proliferation and exercise-induced skeletal muscle hypertrophy. Approximately 50 to 80% of cancer patients experience sarcopenia or cancer-related muscle wasting. Resistance exercise is essential for preventing muscle loss. However, there has been concern that such exercise may also stimulate tumor growth. Therefore, the purpose of this study was to analyze how exercise influences cancer metabolism through the mTOR pathway and to provide evidence for safe and effective personalized exercise prescriptions for cancer patients. Next, I will describe the methods used in this study. A comprehensive literature search was conducted using databases such as PubMed and Web of Science, covering studies published since 1990 to 2025. Using keywords including mTOR, cancer metabolism, and resistance or aerobic exercise, a total of 450 studies were identified. After screening, 87 articles were included in the final analysis. Next is the result and discussion section. This slide presents the outline of the result and discussion section, which will be discussed in the following order. Section 3.1 focuses on the role of the mTOR pathway in cancer. First, introduction to mTOR complex. mTOR exists as two major complexes, mTOR complex 1 and mTOR complex 2. mTOR complex 1 primarily regulates protein synthesis and cell growth, while mTOR complex 2 is involved in cell survival and migration. In cancer cells, hyperactivation of these complexes contributes to tumor growth and metastasis. This table summarizes the key differences between mTOR complex 1 and mTOR complex 2, including their components activating signals, upstream regulators, downstream targets, physiological roles, and sensitivity to rapamycin. Please refer to this table for detailed comparison. Next, mTOR activity by cancer type. mTOR signaling is commonly observed across many cancer types. However, the degree of activation and dependency varies. Breast cancer and prostate cancer, for example, show high mTOR dependency, which is associated with treatment resistance. Clinically, this engages that first, mTOR contributes to tumorigenesis through different mechanisms depending on cancer type, and second, personalized exercise prescriptions are required based on tumor biology. Section 3.2 addresses the effect of exercise on the mTOR pathway. Resistance exercise activates mTOR complex 1 in skeletal muscle, promoting muscle hypertrophy. Aerobic exercise activates AMPK and suppresses mTOR complex 1, thereby improving metabolic flexibility. HIIT stimulates both AMPK and mTOR complex 1 pathways. A key finding is that exercise-induced mTOR activation occurred selectively in skeletal muscle, with limited evidence supporting direct stimulation of tumor growth. Section 3.3 focuses on the anti-cancer actions of exercise. Exercise activates multiple anti-cancer signaling pathways beyond the simple metabolic stimulation. First, here are the main mechanisms of action of exercise in preventing cancer. Exercise activates AMPK, which suppresses mTOR complex 1, enhances mitochondrial function, and activates SAT1 and p53, leading to cell cycle regulation and apoptosis. In addition, regular exercise promotes infiltration of NK cells and T cells, creating a tumor microenvironment that is unfavorable for cancer progression. The following figure illustrates the multi-layered anti-cancer mechanism of exercise on tumor cells. When exercise is performed, metabolic sensors such as AMPK and SOT1 are first activated. As a result, mTOR complex 1 signaling and protein synthesis in cancer cells are suppressed, while cell cycle arrest and apoptosis are induced through p53. At the same time, the HIF-4YAP pathway and immune-related pathways are activated, leading to improvement in the tumor microenvironment and enhancement to the anti-cancer activity of immune cells. An important point to emphasize is the tissue-specific impact of exercise. While mTOR complex 1 is activated in skeletal muscle to promote recovery and physiological adaptation, growth signaling is suppressed in tumor tissue. Ultimately, exercise functions as a biological therapeutic strategy that inhibits tumor growth and metastasis while enhancing responsiveness to anti-cancer treatment. Regular exercise activates mTOR in skeletal muscle while simultaneously creating suppressive metabolic environment for tumors, maintaining a balance between muscle hypertrophy and tumor inhibition. Section 3.4 discusses the clinical application of exercise for cancer patients from an mTOR perspective. Exercise intensity and type should be individualized according to cancer type and molecular characteristic. For example, patients with HER2 positive breast cancer may benefit from lower to moderate intensity resistance training combined with moderate aerobic exercise. Patients with TNBC may benefit moderate to high intensity resistance exercise. Prostate cancer patients undergoing androgen deprivation therapy should perform moderated intensity resistance exercise, synchronized with medication timing. Regarding combined exercise and treatment strategies, aligning exercise timing with pharmacological treatment and circadian rhythms may enhance therapeutic efficacy and reduce side effects. Resistance exercise is generally recommended approximately 24 hours after chemotherapy administration. Section 3.5 presents future research directions. Further studies are required to elucidate the mechanisms by which exercise-induced myokines and exosomes influence tumor metabolism. In addition, large-scale clinical trials are needed to develop biomarker-based personalized exercise prescriptions. Next, I will present the conclusion. mTOR is essential for muscle growth and metabolic adaptation, while simultaneously contributing to tumor growth in cancer. This dual role highlights the importance of precise regulation. However, exercise-induced mTOR activation is selective to skeletal muscle and is therefore considered safe. Additionally, in tumors, exercise primarily activates metabolic and immune-based anti-cancer signaling, offsetting potential oncogenic risks. In summary, resistance exercise activates mTOR complex 1 to preserve muscle mass. Aerobic exercise activates AMPK to suppress mTOR and enhance mitochondrial function, and HIIT induces both anabolic and oxidative adaptations. Finally, the clinical implication is the precise, personalized exercise prescriptions can be developed by considering cancer type, treatment phase, and patient condition. Exercise should be regarded not merely as supportive care, but as a core component of precision oncology. This slide presents the references used in this study. This concludes my presentation. Thank you very much for your attention. Thank you.